Hi everyone, welcome back to Learn with MedNuggets. In today's video, we will discuss a question with you all. So let's dive right into it. You can pause the video right here and read the question. Alright, so first let's identify the key words of this question. The girl in this clinical vignette is 18 years old and she has episodes of binging and purging. For those who don't know what binging and purging means, binging is overeating and purging is vomiting, right? And her BMI is 21, that's normal, and her physical examination shows dry mucous membranes, which is a sign of dehydration because she's vomiting everything she's eating, and she also has enamel erosion and parotid gland hypertrophy. So from this information, could you guys tell me the diagnosis? We definitely know that this is an eating disorder, something along the lines of anorexia or bulimia nervosa, but which one is it? Now, this brings us to eating disorders. There are 3 types of eating disorders that you will be commonly tested in your exams, which is anorexia nervosa, bulimia nervosa, and binge eating disorder, right? So anorexia and bulimia, these 2 conditions, they have a similar presentation. They present with episodes of binging and purging. To put it in simple words, it's always going to be a girl, most of the time a teenager, who is overly concerned about their appearance and is therefore vomiting to compensate for eating. So basically vomiting, aka purging, is a compensatory behavior. But when it comes to binge eating disorder, these people, in people with binge eating disorder, there's no compensatory behavior. So for instance, this kind of a girl would have episodes of overeating out of nowhere. Like one day they would open the fridge and eat everything in the fridge, like literally everything. It doesn't necessarily have to be tasty food, right? She's just going to eat everything that she could lay her hands on. This kind of uncontrolled eating behavior without any compensatory behavior is the classic presentation of binge eating disorder. Now, moving back to anorexia and bulimia nervosa, since they have a similar presentation, an easy way to differentiate the two, actually the best way to differentiate the two is by checking the BMI. If the BMI is normal to increased, which is usually 18.5 to 30, that means it's bulimia nervosa. Whereas if the BMI is low, if it's below 18.5, it's anorexia nervosa. Okay, is that clear? Right. So over here, the diagnosis is bulimia nervosa. There's episodes of binging and purging, enamel erosion, which is a sign of purging, because when you purge, there's a reflux of stomach acid into your mouth, right? And this can dissolve the enamel of your teeth. And this girl also has a normal BMI and parotid gland hypertrophy, which is once again a characteristic feature seen in patients with purging behavior. Board exams, they love to go after this. They love to test this point. Sometimes they like to give this as an answer option, like what would you see in this patient? And they would list options like hepatomegaly, parotid gland hypertrophy, blah, blah, blah. And the answer is always going to be parotid gland hypertrophy. So remember this point, like try to really drill it into your brain, okay? So now let's move to the answer to this question. First of all, you need to know which electrolytes are found most abundantly in the stomach, right? So our stomach is acidic. It mainly consists of HCl and other positive ions like potassium, sodium, and stuff like that. So when you vomit the hydrogen ions, chloride ions, and potassium out, which means the concentrations of these ions in your body will decrease. So hydrogen ions will decrease, chloride ions will decrease, and so your body's H+ content will go down. Now we know from chemistry that when H+ decreases, bicarb increases. As a result of that, your pH will increase and it will become more alkaline. Acidic means more H+, basic means more OH-, right? Those are the basics. So the answer to this question is B. Another extremely important point you need to remember is that when you vomit, you lose H+. As a result, your pH will go up, right? On the other hand, in diarrhea, you lose OH-, so your pH will go down, right? So if a patient is vomiting, your pH will increase. If a patient is abusing laxatives to lose weight, then the pH will decrease. So that brings us to the end of our question series. Thanks for watching. Have a great day.